What does HSIL mean on your Pap smear results? Imagine your Pap smear results come back with the term HSIL. What does that really mean for your health? Well, HSIL stands for high-grade squamous intraepithelial lesion. It indicates that the cells collected from your cervix show moderate to severe abnormalities. These changes are more serious than low-grade lesions and suggest a higher chance that the cells could become precancerous or even cancerous if not properly managed. To understand this better, think of the cells on your cervix as the surface covering. When they are normal, they look healthy and uniform. But with HSIL, these cells have significant abnormal changes, known as moderate or severe dysplasia. This is a sign that the cells are not developing normally and need further investigation. Most cases of HSIL are linked to infection with high-risk types of human papillomavirus, or HPV. This virus is the main cause of cervical cell abnormalities and cervical cancer. Studies show that up to 90% of HSIL cases are associated with high-risk HPV types. However, a small percentage may be caused by other factors, but HPV remains the primary concern. It's important to remember that an HSIL result does not mean you currently have cervical cancer. Instead, it signals that abnormal cells are present and could progress to cancer if left untreated. The risk of progression is relatively low but significant enough that medical intervention is recommended. Without treatment, about 1 to 2 women out of every 100 with HSIL might develop cervical cancer over time. The progression from HSIL to invasive cancer usually takes several years, often between 5 and 10 years. But this can vary depending on individual health and other factors. Early detection through screening and prompt treatment can greatly reduce this risk. So, what happens next? Your healthcare provider will likely recommend a procedure called a colposcopy. This involves examining your cervix more closely with a special microscope to identify the abnormal areas. During this exam, a small tissue sample called a biopsy is often taken to confirm whether the abnormal cells are precancerous or if there is any invasive cancer. Treatment options typically involve removing or destroying the abnormal cells. Common methods include loop electrosurgical excision procedures or laser therapy, both performed under local anesthesia. These treatments are effective at eliminating the abnormal tissue and preventing progression to cancer. After treatment, follow-up is very important. Regular Pap smears and HPV testing help ensure that the abnormal cells are gone and that no new changes develop. Maintaining a schedule of screening is key to catching any issues early and keeping your cervix healthy. Certain factors can influence your risk of persistent HPV infection and abnormal cervical changes. Smoking and a weakened immune system can increase this risk, which is why regular screening is so vital. It helps catch problems early when they are most treatable. In the broader context of reproductive health, managing HSIL is a crucial step in preventing cervical cancer, a major reproductive cancer affecting women worldwide. While testicular cancer is unrelated to Pap smear results, understanding the importance of early detection and screening highlights how vital routine checkups are for overall reproductive health. In summary, an HSIL result indicates significant precancerous changes in your cervical cells. It requires prompt follow-up and treatment to prevent progression to cervical cancer. While it can be concerning, it is a manageable condition when caught early. Always consult your healthcare provider for personalized advice and care. Regular screening and early intervention are your best tools for maintaining cervical health and preventing cancer.